Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik NIkam. Today I have Dr. Ashima Chauhan. Is that how you say it?
Yes.
And she is
family medicine.
Family medicine.
Hospitalist.
She is the president of the Indian Doctors Association, and she's going to tell us something about the Indian Doctors Association. Ashima, welcome to Triple N Media, and we are delighted to have you. Give us a little bit about your background before we get into the Indian Doctors Association.
Thank you so much, Dr. Nikam, for inviting me here. So I trained in India. I did my medical school over there, and then after I came here, I did my residency in family medicine in Methodist in Baytown, and I've been working as a hospitalist since I graduated in 2014.
14, it's almost close to 10 years.
Yes, time flies.
That's good. Tell us how you got involved with the Indian Doctors Association.
After I graduated and we moved to Sugarland, I was just finding ways to connect with the doctors there because I didn't know anybody. So I found out about IDA and I went to one of their mixers in Clear Lake and I met Dr. Ashima Chauhan over there.
Yeah.
And he actually asked me to become a member and join.
That's interesting. I've been in Houston since 1980. I think the Indian Doctors Association was started in 1981 or so.
83.
83. Okay, so I have been a member of the Indian Doctors Association.
For a long
and I
time.
was the president in 2008.
Okay.
So I know the long history of Indian Doctors Association. Maybe you can tell the audience about, what is Indian Doctors Association and, what's its mission and what does it serve?
So it was initially started as a way for all the physicians in the Houston area to network, and then gradually, as the time went by, it's become more like involved in, besides the mixers, charity work. So supporting the Indian Doctors Charity Clinic, plus having scholarships for high school students, and now we have endowments in all the medical schools as well. So beyond just networking.
That's fascinating. And how many members would you say belong to the Indian Doctors Association?
Their members are going up with each event. So I would say right now maybe we are close to 400. I don't have an exact number because after each event we see an increase in.
Yeah, I have definitely seen over the past decade the number of people attending various like mixers and especially the Gala. It has significantly gone up, and maybe it's a tribute to all the past presidents, who have put in a lot of effort to bring the new generation physicians. And because when we started, it was all like a first generation Indians.
Right.
Now I guess you have a more second generation.
Yeah, mix of both.
Mix of all these things. Yeah. So what are the different activities that the IDA is involved in over a course of a year?
Yeah, so we do mixers, which we do in all the parts of town. So that's about 5 of them, like Woodlands and Clear Lake, Medical Center, Sugarland, Cary. Then we do like a annual picnic in Sugarland, which is usually one of our very popular events. And then we do a CME event annually, and our annual gala. Plus there might be 1 or 2 more like community events. Like last year we did a musical event. Prior to that, we did a car and wine event. So.
Oh, I see. Yeah, that's pretty good. And you do have a website, right?
Yes.
What is it called?
IDAHouston.com.
IDAHouston.doc. If any one of you would like to get more information about the Indian Doctors Association, or if you'd like to volunteer or become a member, or maybe aim for becoming the future president.
Definitely.
If somebody wants to know more about the Indian Doctors Association, who do they really try to get in touch with?
They can get in touch with any of our board members or me, and I can direct them wherever, whatever they want to do.
Oh, I see.
But the best way would be to go through the website, IDAHouston.com.
I guess they can just register on the website.
Become a member, and they'll get the newsletters and all the information.
Oh, okay, that's a good way for them to just get involved. If somebody wants to get involved, just go to the website, register yourself, and how much is the annual membership?
Annual membership is $100 and lifetime is $1,000.
Oh, that's good. So, if you plan to be here in Houston for 20, 30 years, maybe
better to get the
pays
lifetime.
to get the life membership, $1,000. And when when I became a life member, it was around like $750.
Right.
Tell us about the different scholarships that IDA is involved with,
So
and
we
how do you select the candidates?
so we have a scholarship for high school students, which are about 5 that we give every year. I think they're about 2,500 each. So we sent out all the information packet to all the counselors of all the high schools in the
I see,
Houston
yeah.
area. So all the school districts.
There must be many high schools.
Yeah,
in
so
the
we
Houston
send
area.
it to like all the school districts like Sugarland, Fort Bend,
Fort Bend, ISD,
Katy,
Elif,
Memorial, pretty much all. Then we get some applications. We usually get about close to 100, 200. And then Dr. Manish Gandhi and Dr. Purva Pancholi,
I see.
they are the main people and scholarship committee. So they
have to scan through all these.
Yeah, so they have a
different-
meeting and we go through all the applications. We have points for each criteria we look at, and according to that we select 5 students.
You know what they do at the universities? They get like 6,000 applicants for like,
Oh, wow.
like 200 seats. So they have to fill out online application, which
Right.
kind of helps to
Yeah,
streamline the long list of candidates.
right.
Let's talk about the gala. You know, what's the main theme of the gala, and so what are your plans to take the IDA to the next level?
So the gala is our largest fundraising
Yeah.
event. So the goal is obviously to generate enough funds so that the IDA can run for the next year, plus we have enough funds for the charity initiatives, like we give a big check to the Indian Doctors Charity Clinic every year. That expense comes from the gala, plus
I see, yeah.
all our scholarship money also comes from the gala.
Yeah.
So so the goal is always to try to get like more sponsors and more people to attend the gala so that we are able to continue doing what we are doing.
And you also have continuing education programs. And
Yes.
Maybe you can tell us something about the continuing education program.
Yeah, so we have an annual CME,
Yeah.
which always includes the 2 hours of ethics.
I see. Yeah.
Plus there are some other points. Last year it was like total of 6 credits, including 2 of ethics. So it's a kind of half day thing that we do, usually Sunday mornings, starts at 8, goes on till about like 3, 4.
Yeah.
And it covers like a variety of topics.
Yeah, in fact, I attended the last one,
Yeah.
which was quite educational, and
Yeah,
it's a great way to network with other physicians and also, get to know people in the community and
get your
it's a-
ethics points too.
get your ethics points, 2 hours, which
Yeah, definitely.
plus 6 hours of continuing education.
Yeah.
That's fascinating. Ladies and gentlemen, you have been watching NNN Media. I'm Dr. Nik NIkam, and my special guest is Dr. Ashima Chauhan, and she is the family doctor. And now you practice in Sugarland?
No, I'm a hospitalist with HCA.
Oh, I see.
HCA Southeast in Pasadena.
Oh, Pasadena. Oh,
Yeah.
I see. So that must have been a long drive.
40, 45 minutes.
Is that-
It's
yeah.
okay, not bad.
Okay. What else can you tell us about the Indian Doctors Association that might get people interested in?
So I would encourage everybody who should try to become a member, because it's a great way to meet new people, especially physicians that are starting new practices, for them to network, get to know other specialists and other PCPs. And plus there is a component of charity too, so you can volunteer at the Indian Doctors Charity Clinic, and then we have a whole variety of different events. There are other outreach events also that happen, so there's a lot of things going on.
Maybe you can tell us a little more about the Indian Doctors Charity Clinic. And I know it's been there for
A long time.
more than 3 decades.
Yeah.
And it has served. In fact, I was there last Saturday.
Okay, so they were
covering the
located
clinic.
in Bel Air
Yeah.
for a long time. Dr. Katie Shah was kind of running the
Yeah.
whole thing single-handedly. Like before COVID, I think they kind of closed, and they were looking for a new place because there were some issues with the lease and
Yeah.
trying to find a bigger place. So after this whole COVID pandemic and everything, now they moved to the Gujarati Samaj
Yeah.
Center on West Belfort. And they just opened like a couple of weeks ago. It's like a slow opening. They are starting with Saturdays with primary care and ophthalmology, and gradually they're going to expand to multiple
Yeah.
days of the week and more specialists and everything.
I know. As I said, I was there last Saturday. So, ladies and gentlemen, if any of you would like to get more information about the Indian Doctors Charity Clinic, you can visit the Indian Doctors Charity Clinic website, or you can contact the Indian Doctors Association. And if you want to volunteer, this is a great way to serve the community. The Indian Doctors also gets involved with a lot of community events. Can you tell us something about that?
So we have other events also that we do, like go to elementary schools, kind of do like a career day, and we did like something in a collaboration with the food bank, some walkathons in the past. So there are different events that we do.
Yeah, that's interesting, because when I was in Sugarland, every year I used to go and give presentations to middle school students about WATCH program. Which is kind of very interesting, because obesity is a very, very prevalent entity in school children. 40% of the school children are obese. And of course, they have changed the food that is served in schools. But still, I guess you've got a long way to go to curb this obesity, and that which leads to, of course, sugar and high blood pressure in the young teenagers. So, what do you see as the future for IDA? There are actually more than 1,200 physicians. This was statistics which I got a few years ago. It may be much higher now. More than 1,200 physicians of Indian origin in the Houston area. I don't know if it covers residents and fellows.
No, it does. It does.
It does. So how do we attract all these 1,200 people to be involved with the Indian Doctors Association?
We just keep reiterating all the benefits, and whoever any new physician that moves in, if they ask for any places to network, then let them know about IDA.
The majority of the physicians have joined the hospital, like yourself. You join the hospital or a hospitalist group, and a lot of them feel like they don't have a necessity to network. Like they are not in private practice. They are not trying to promote themselves or introduce themselves to other specialists. So how do we address that issue?
So it's not just networking. I mean, there's like family events, like the picnic, and then you have community where you can do charity. So it's a component of everything, whatever interests. Some people like to just do like social events. Some people like to do networking. So we have everything.
Oh, that's fascinating. As I said, we have close to 1,200 people, and what can be done to inspire these people to get involved with the IDA? I mean, it's for their own benefit, basically, because, of course, we'd like to commingle with people of same frequency in terms of knowledge, in terms of our interests, in terms of our professional goals, things like that.
So I think if they attend any of the mixers or any of our other events, then they'll realize what the benefits are, and maybe that might make them consider joining IDA, because usually after each event we have some new members sign up.
I see, So maybe we can give out the address for the Indian Doctors Association website again.
It's idahouston.com.
So idahouston.com. Okay, so it's idahouston.com. Ladies and gentlemen, I have been talking to Ashima Chauhan. She is going to be the president. She is the president of the Indian Doctors Association, and we talked about the various activities that Indian Doctors is involved in terms of education, in terms of networking, in terms of social interaction, and also with the community involvement in many, many respects. I guess you also want to maybe emphasize the fact that we attend so many health fairs that are happening all throughout the city.
So there is the BAPS. They have an annual health fair, and in the past, IDA has collaborated with them, and we haven't done it because of, I guess, the COVID. But in the past, like some physicians from IDA have volunteered at that.
Yeah, that's true, because the COVID has sort of put a brakes on many of the non-essential activities in our lives, and we're just coming out. As a matter of fact, the federal government just lifted the COVID emergency on May 12th.
I saw
because the last time I had to go to the VA hospital, like 1 week a month, and I was still wearing a mask.
Okay.
So when I go next week, hopefully I don't have to be wearing the mask.
I think they still have, the masking is still going on.
Is that right? Because what I was told was that since the federal government lifted the emergency, they may not require us to wear masks. I don't know about the hospital.
So last I went to work was last Sunday.
Yeah.
But till then they were all wearing masks.
Right?
I don't know. At least in the physician and patient interaction area.
Yeah. Yeah, I think the last 2 years or more than close to 3 years
Almost
now.
3 years.
It has been like our whole life has been in dark. From the COVID. And so how did you manage as far as work as a primary doctor or a family doctor during this COVID era?
I mean, it was difficult because I'm a hospitalist, so when all the COVID patients started coming in, initially it was very scary because we didn't know what's going on, we didn't know any treatment, and then we're reading about New York, and it was scary.
It was.
And all the hospitals, they were being very stingy with the PPEs initially. And so it was scary, but I guess we got used to it, and different treatments coming in. It was just trying one thing or the other.
Ashima, it's been a pleasure talking to you, and I'm delighted. What is the next event coming up?
So because of summer, we are going to not do anything next couple of months, but after that, I'm planning the CME event.
Oh, see, when is this going to be?
Tentatively might be sometime in September.
September?
Yeah.
So, ladies and gentlemen, please do visit the Indian Doctors Association website, which is idahouston.com, and become a member and get involved. And we would like to see you being part of an organization which I think belongs to you more than anyone else. Thank you so much for coming, and I'm delighted, and good luck with your new endeavor, and hopefully maybe we can take the IDA to the next level, and hopefully maybe see more people get involved with the association. I mean, that's the best way for professionals to network, interact, and communicate with people, at least here in the community, which is much easier. Because when you go to the national associations, we meet for 3 days, and you forget most people you met.
Right.
Okay, thank you so much. Ladies and gentlemen, please do subscribe to our YouTube channel. We'll see you in the next presentation. Bye.